Anybody who knows me will not be surprised to hear that my entry point into global health started in a moment of rage when I was 16 years old. I had decided at that point that I needed access to hormonal birth control in order to protect my health and to have the future that I had planned for myself. And it became clear very quickly that growing up in a conservative Catholic family in the suburbs of Chicago, I was not going to get any assistance getting access to birth control. It was sort of my first lesson in global health that our health is often dependent upon the social norms in the place that we're living and the decisions of other people. And that sent me on a path that's taken me to where I am today. Becoming aware of sort of that intersection of gender and social norms and health. As a high school student, it became clear to me that I needed to go and study something relevant, and I took undergraduate degrees in sociology, psychology, and then a minor in Spanish. I moved to Santiago, Chile, and I sort of grew up in a very local, very grassroots chapter of the International Community of Women Living with HIV. It's run by an incredibly dynamic Chilean woman. Her name is Marcela Silva. She has been delivering really strong grassroots advocacy efforts for decades now on behalf of women living with HIV, but also women and girls who are vulnerable to acquiring HIV. She and the rest of her colleagues took me under their wing and taught me a lot about how to make sure that health services are adapted to meet the needs of everybody who needs them. I found my way to Ethiopia, and I worked for another local organization that was focused on improving health in the Somali region of Ethiopia. A totally different context. I was working with colleagues who were from the region, who had deep ties, and my objective was to learn from them the types of solutions that were needed in the region to increase access to basic health services in a relatively remote area of the country. I spent a number of years overseeing programs in West and Central Africa. March 2020. I watched the health system of my own country and that of every country that I was supporting suffer and struggle to adapt to a profound health crisis.
And every day, that number grows.
I knew that my focus to date on health systems, my focus to date on services was insufficient. It was time for me to pivot. I needed to better understand what it takes to be prepared for, to be able to prevent, detect, and respond to the next scary emerging pathogen. Global health security is a term that is relatively recent, but in reality, we have a long history of experiencing, surviving, and thankfully learning from global public health crises since 165 AD, where we saw the Antonine Plague devastate the Roman Empire at the height of its power and influence. The Black Plague, which some estimates put it at 200 million lives lost, at a time when the global population was maybe 475 million people in total, all the way to our present day, our recent experience with COVID-19. Over time, it became clear that the way to protect and prevent these pandemics from occurring over and over again was to establish a mechanism for the world to coordinate and agree upon certain standards that we would all meet, and that those standards would act as a preventative barrier to the spread of infectious disease and the devastation associated with them. The first significant instance of this that we see is in the International Sanitary Conferences that happened in 1851. That was the first time that world leaders came together and agreed that it was absolutely necessary for us to commit ourselves to upholding certain standards that had both to do with the way we managed our individual health systems, but also the flow of data and information between health systems, such that each population can protect itself. Over the past 100 years, we've seen a dramatic increase in travel and in trade, such that any person can be in any other place within a 24-hour period. Any prior impression that we could protect our health and well-being and prevent the spread of infectious disease only within our individual borders has been shattered.
Deadly SARS outbreak in
the
China.
SARS outbreak.
Outbreak of the H1N1 virus.
H1N1 swine students have reported symptoms of the try to fight the Ebola outbreak.
Deaths still being reported and thousands still.
The health security of any nation can be rapidly, almost immediately impacted by any other. And that's the experience we just had during the COVID-19 pandemic. Two other major moments in the field of global health security were the establishment of the International Health Regulations by the World Health Organization beginning in 1969, that are by far the most concrete measures by which we are assessing our adherence to this commitment that we are going to work to prevent, detect, and respond to pathogens. And then more recently in 2014, the Global Health Security Agenda was established. And one of the primary objectives of that agenda was to build accountability. It's all great and good that we have a commitment to enhancing our health security capabilities, but unless we have sort of measurable standards and a tool to assess whether or not each country is living up to its commitments, we're not going to be able to make progress. So the 2014 Global Health Security Agenda set forward a specific tool called the Joint External Evaluation, and that is what's being used to conduct health security capacity assessments. So that brings us to the current day. World Health Organization member states are deep in the weeds negotiating the pandemic accord. And this is the most recent iteration of our shared global commitment to improving our health security. Perhaps most significantly, among the many lessons we learned from COVID-19 was that our global response to the pandemic was deeply inequitable. We saw inequity within countries' populations, whereby specific, more vulnerable groups were dying at a higher rate. There were inequities between countries, in that some countries had the ability to purchase and distribute COVID-19 vaccines at an early date and cover all of their population. Other countries struggled to gain access to those. And what we're doing right now is there are clauses being proposed in the pandemic accord that would begin to address that inequity. One of the most interesting elements of the pandemic accord is an element called the PABS, Pathogen Access and Benefit Sharing System. The objective of this clause in the accord is to establish an agreement by which countries will share information generated from testing pathogens that is necessary and needed for the creation of therapeutics and vaccines. We want to accelerate the ability of our various pharmaceutical firms, companies around the world, manufacturers, to gain access to necessary information, But simultaneously, the fruits of that labor, which are vaccines, therapeutics, medicines that are needed to help treat and prevent the spread of these pathogens, they need to be made accessible to all countries, regardless of income level of development. And that was a massive failure of the global community during COVID-19. App Global, as one of the world's leading health system strengthening partners, has all of the technical capabilities across health systems necessary for improving health security. We have expertise both in infectious disease systems, so those are disease surveillance, laboratory capacity, specimen referral systems, diagnostic networks. All of those come from our infectious disease portfolio, and then those are complemented by one of the largest portfolios of health system strengthening work in the world. And that complementarity means that we've got subject matter experts that are already working on these issues, are already setting forward strategies with our partner governments. We have the subject matter expertise necessary to provide that partnership to any host country government where we can work together to develop a vision for strengthening their health security capacities. I mean, I see this as a field that's rapidly emerging and evolving. We have an incredible amount of momentum behind us, and at APT, we've had the space to spend some time thinking, strategizing. What can we do to push the field forward? And we see incredible opportunities, especially in the area of One Health. One Health is the concept that we have human, animal, and environmental health. And for a long time, and in a lot of places, we have treated those things very separately. And this is despite having long had the scientific understanding that these things are deeply interconnected. We've long known that zoonotic disease is a primary source of infectious disease for human beings, but it's only recently that we're seeing a revolution in the global health space that acknowledges the need for One Health, and it brings that strategy sort of to the center of what we're doing in the field. So we've been bringing together our technical experts from these fields in a technical working group that has allowed us to define, what are the solutions that are needed to ensure that at these different interfaces, things are not being done in an ad hoc manner. It's impossible for us to pinpoint and predict exactly where the next scary pathogen is going to emerge. And having a One Health system means that we're covered. There's visibility, there's a response plan in place, and the right stakeholders are prepared to activate health information systems that are integrated and interoperable across these interfaces. So as a pathogen emerges, that data is available not only to the Ministry of Agriculture that's keeping an eye on aquaculture and the diseases that are cropping up there, but also to the Ministry of Health, who can collaborate with, normally in a One Health working group or a One Health technical committee, on a holistic response. It's 2024, and we all experienced what was one of the most profound and challenging public health crises in the history of the world. And in addition to that recent lesson learned, that shared understanding of what it feels like to be in the midst of that type of crisis, we have the most public funding that we've ever had dedicated to strengthening health security. We have an extreme amount of attention all over the world on how we're going to prepare for the next pandemic. And we have the most advanced technology that we've ever had. Is health security an incredibly challenging field? Yes. And whether we succeed or fail has a tremendous impact on people everywhere. But given how much momentum we have under us right now, given the lessons learned that we have from multiple successive public health crises, decades of experience learning how to make health systems more effective, and political will and commitment across the world to advance health security capabilities, we have the opportunity to put in place the systems, the policies, the programs necessary to prepare for the next great pandemic.